Hello, welcome back to my channel. My name is Anna Rule. I'm a registered nurse and I hope you're doing well. I know it's been a long time and I must apologize for the long period of break between videos. I recently started back school, well, maybe like last August. And I'm still trying to figure out work and school and personal life balance. I haven't mastered it yet. I'm still working on it, but I'm like, that's not enough excuse for me not to put on more content and videos and just to check in with you guys. So I apologize for that. And we're going to try a little bit harder. No guarantees, but we're going to try a little bit harder to get more videos out. But I really want to do this video because May is actually Mental Health Awareness Month. And there's been so many things happening, and I think I want to touch on this topic a little bit. I don't want to make this first video too long, so probably gonna have two parts to it. So we'll just do the first part and then I'll follow up with the second part for this mental health awareness. I'm actually gonna start off by reading some facts from the CDC website, the Center for Disease Control and Prevention website. And so you're gonna see me look at my paper because I'm gonna read I printed everything out. And as I read a point, I'm gonna like expand more on the point. Okay. So I'm going to read this probably like verbatim or close to verbatim. So it's basically saying that mental health includes our emotional, psychological, and social well-being. And I know often many times the whole image of health, and for those who are probably in the healthcare field, when you think about health, it includes all of the specialties. So I know a lot of the time, maybe when you go to your primary care doctor, or when you go, you may just go for like an acute pain, or you may go for something that you're thinking is physical. But a very good part and a very important part of health is to monitor the patient's social well-being. Okay, how is this pain affecting you going out, providing for your family, taking care of yourself on a daily basis? So that pain affects your social well-being, and it affects your emotional well-being. Are you a person who's used to not being in pain? So is that pain has made you not feel as though, okay, maybe you're weak, or maybe you're not used to expressing pain, but this pain is becoming so unbearable. Talk about mental well-being. Are you getting a little bit depressed or down about this pain, because now this pain has affected your entire life? As I said, your work schedule, your sleep schedule, your recreational schedule, spend time with your friends and family. So when we think about mental health, we have to think about how everything plays a part and it contributes to the person as a whole. So that's one thing. So although the term is often interchangeable, it says poor mental health and mental illness are not the same. So what I described to you before was like poor mental health. So for example, a person who is probably undergoing a situation, and at that moment, but I want to say we all, but most people have times when we're just going through something. A situation happen, and whether it be something in your personal life, like a relationship, something with your kids, or something at work. So for that time, you're like, I just need a moment, or I need some personal space, or I need to figure things out. I've not been feeling myself. So at that period of time, you may have a period of poor mental health. So you're going through something situational. It's not like a chronic situation, or it's not something that you may feel as though you have been dealing with for a long period of time. Something happened, and for that moment, you're not in the best mental health space. Now, mental illness is a little bit different, because when it comes to mental illness, we're talking about a diagnosis. Sometimes, unfortunately, it's misdiagnosed. Sometimes it's underdiagnosed. But it's an illness that has been shown to have certain criteria. So there's a thing called DSM-5 that is used to diagnose mental illness, and different mental illness may show different characteristics, and they have to happen over a period of time, to be honest. So some may see 6 months or more, and that would qualify for mental illness. And we're talking mental illness, we're talking about maybe come from depression, schizophrenia, bipolar, ADHD. Like, there's so many different mental illness out there, but poor mental health and mental illness are two different things. So just not to get confused that because someone's going something, say, okay, they have a mental illness. So that's something to pay attention to. So another thing, that there's no sign for mental illness. So sometimes we just don't know. And we don't know because we've not been exposed. whether it be through formal education or through exposure through families or discussions or reading. Sometimes we just don't know. And not knowing can sometimes make you not be able to understand what the person is going through. And also, the person not doing themselves may be hard for them to explain to you what's going through or what's going on with them. Take for example a child, they're trying to explain to you that, okay, something hurts, and they don't know exactly how to say it hurts or how to rate that pain. So, like for those who do pediatrics or those who see, children, there's a thing that we call the pain assessment tool. It's basically a tool where you have faces. So you have like a mild pain, like a 0 to 1, maybe like a smiley face, and then as the pain gets worse, it'll go from like a to like a frown, or we'll get like the images will show that the severity of the pain is greater. So I normally do with my students or my kids is that I would say to them, okay, look on this picture, which of these faces say how you feel right now? And then with that, the child will point on that image, and I'll say, okay, based on the point, it's a 3 to 4 pain, a 3 to 10 pain, or it's on a scale of 1 to 10. So that will allow me to rate the child's pain, because they don't notice that on a 3 to 10 pain. Just like how you probably would not know, like what I'm experiencing right now, maybe depression. What I'm experiencing right now may be anxiety. It may be a panic attack that I'm having. What I'm experiencing now is just some feelings of paranoia, or I'm hearing voices. So it's just hard for you to really explain when you just don't know what you're experiencing yourself. But one of the things is that too, is to keep in mind that there are many factors that contribute to a person having a mental illness. So we're probably going to go into that a little bit more detail, but there's so many different factors. Yes, there are genetics. Sometimes there's also the influence of alcohol or drugs that may influence a person, getting a mental illness because of the change in neurotransmitters in the body. There's also chemical imbalance. And I mentioned before neurotransmitters. So neurotransmitters are basically chemicals that are in the brain that trigger neurons and trigger certain responses. For example, those who have had kids already, it said like, okay, after you have that child, no matter how much that mother is in labor and she's in so much pain, once that baby is born, it's like all the pain is gone. You forget what you have gone through, and you just literally no, it's like, oh my gosh, the greatest gift I have is in front of me. So that is a neurotransmitter that is influenced by a chemical balance where the hormones have now changed, and you're not feeling a period of joy. So in the sense that when it comes to, and especially for depression, for example, there's this thing called serotonin. So there's a levels of serotonin influences how much a person, or the degree of depression. And then we do prescribe medication. That's what we're trying to get that balance back. Another thing, such as biological factors, as well as experience related to other conditions. So I mentioned earlier to you about the pain, like for example, someone who has chronic pain, for example, someone who has diabetes, for example. And for chronic illness like that, for example, for diabetes, it takes a toll on the body, and the toll does not happen right away. It could happen over a period of time, especially for those with diabetes after maybe like 10 to 15 years, and the organs start to be affected. So this in itself can affect your mood, because you know who you were 10 years ago based on how you are now, and like you're like, this is not me. And it's hard for you to explain to someone who doesn't have the condition what you're experiencing, because this is not you, but you don't know exactly what is not you. So that is one factor as well. Adverse lifestyle, or such as trauma or history. So for example, those who have been experienced traumatic experiences, whether it be abuse, whether it be sexual abuse, physical abuse, domestic violence situations, trauma, PTSD. Those have been, like, for example, you've gone through, been in a violent situation. That can also influence how you interpret that experience, and also how your body copes and deal with that experience, and that can affect your mental well-being at that moment. And if not noticed, or if not treated early, it could lead to long-term effect and could last for maybe periods of 6 months or more, and then we'll start to have certain diagnosis of mental illness being diagnosed by a healthcare professional. All right, so we are gonna pause for a minute, and then we're gonna pick up back on the second part, And the rate I'm going to think it may be 3 parts, but we're going to pause for a second and then I'm going to do a part 2 of this video. So thank you for joining me. The discussion is going to continue. As I said, May is Mental Health Awareness Month. So this is an ongoing conversation. We're going to try to have more of these conversations for the month of May. And do comment in the below. Let me know if there's something you want to know more about, or especially for mental illness. And I'm going to try to put also in the comments some resources that we can possibly reach out to or use to whether help ourselves or our loved ones, or just to provide information for those that we think may need it. And just keep in mind that not because you're offering it means that it will be received. So that's something to keep in mind, because the person may not think anything is wrong with them or situation. So accepting that there's a need for help or intervention is also a big part of treating mental illness. So that's something we're going to work on. So thank you once again for watching, and I will see you in part 2. Thank you. Bye bye.